Okay, so we're going to just start, everyone, and because we have people online. So good afternoon. Thank you all for joining us. We're very fortunate to have Professor Eujessika Rodrigues joining us from Brazil. And she's going to share with us the work that her technology center is doing around the use of wearables for research, but also in clinical care and for health among elderly. So Professor Rodrigues is a tenured professor at the State University of Paraíba. I'll improve my Portuguese. And she's actually just fresh to this professor position, so congratulations. She's also done collaborations with UFRN University in Brazil as well, in Natal, and many of you answered a survey around your interests so that we can make links between researchers there and your work. And currently, Dr. Rodrigues is the Deputy Coordinator of the Biomedical Computing Laboratory at the Center for Strategic Health Technologies. And they're working very closely with the Ministry of Health in Brazil and their institute in order to look at the development and scale up of the use of technologies like wearables across the population, and also using that for prevention among the elderly. What she'll be talking about today in part is one of the projects that they've been working on, which is a platform for the remote monitoring of older adults using wearable devices and developing intelligent algorithms using AI in order to track key health indicators among the elderly in the community. Their team is quite extensive. Dr. Rodrigues herself is a physiotherapist with extensive training in technology, and they also have a team of developers and data analysts and economists that work in their institute and with the Ministry of Health. So, Dr. Rodrigues, I'll turn it to you.
Okay, so good morning, everyone, again. I'm going to talk about the development and clinical applicability of the smartwatch for monitoring the elderly people. But first, I would like to introduce myself for the people as watching now. My name is Eujessika Rodrigues. I'm PhD in physical therapy, but I did my master's degree about health science and technology, and now I'm professor at the Department of Physical Therapy at the State University of Paraíba. I'm coordinator of the Biomedical Computer Laboratory at the NUTS. I would like to talk and give more details about the NUTS because the NUTS is our center of technology. And nowadays our work is in the technology development for the healthcare sector with a project to focus in the monitoring system for the elderly people. So, but first I would like to give more details about the NUTS. The NUTS is a center for strategic health for technologies. We are in two different locations. The first one and the main hub is in Campina Grande, Paraíba. Paraíba is a state, the northeast of Brazil. And another one location is in Brasília. Brasília is a capital of Brazil. So we develop the products in this both location. And we are a science and a technology institute specialized in research, development, and innovation. And we provision the technology services aimed to company, to government, and research sectors, factories, universities, and something like that. So we have a team to work inside of the NUTS. At the moment, we have more than 11 PhD professionals, 4 administrative techniques and 6 quality techniques, 10 laboratories with different expertise. I will talk more about this. And more than 100 researchers, developers, data scientists, engineers, healthcare professionals in different education levels, graduates, master degrees, doctors. And in the last years, we developed several projects. Here, there are some partners that we make this project. I can highlight the Siemens, Fraunhofer in Germany, UC San Diego, USA, and yeah. So this is technology's position. We work in this main line of research. So there are several projects we are developed there, and this is the main line of research, the three-dimensional technology, the medical device, artificial intelligence, soft engineer, usability and human factory, and also we have a strong line of research with the health technology assessment. In this area, we work together with the Ministry of Health in Brazil to decide and to help them to make the full assessment about effectiveness, safety, and assessment about the economic evaluation and the budgetary impact to incorporate a new technology in our system, right? So we working in all these levels. Sometimes we receive a project into the notes in TRL in this zero, the technology readiness level. So we working in all these stage, all these steps, since the idea to the final product, to the product to go to the clients, to the markets, the companies. So we're working in all this level in your center. So this is the main certification that to work in Brazil with technology solutions. So here I would like to show you just a few projects, the public, just for you have idea what we are doing there. So we produce in a company, in our center, the cardiovessor and multi-parametric monitors. So we produce the medical devices inside of the notes, and we produce it there, and then we throw out for all country, for all the public hospital. We produce this kind of the machine. They produce is cheaper for the Ministry of Health, and then we can share for the public hospital in Brazil. We also develop the mechanical ventilator machine in our center. We also work with 3D technologies products. So we develop this laboratory. They are responsible to produce the orthoses and prostheses also. And they produces also the surgical guidance and the biomodels. So with this product, with this project, the doctors can be able to training to practice the surgery before, and it's very good because with the practice, they reduce the time of the surgery. They reduce the time with the patient under anesthesia, and reduce the infection and a lot of benefits with this kind of the project. They was responsible to produce some prostheses to go into the body also. And we have a lot of experience to develop the software to manage to hospital management. For example, to store medical medications, to bed hospital management, electronic medical records. So we have a lot of experience. So for example, in our state, all the software solutions is developing with us. We develop everything for our state. So this is our example about our project for using the artificial intelligence. This is to stroke classification using the images. So we also work with something like that. This is the other project that we are producing the smart insole to detect the different pressures when a person walk or just stand, and we are studying the using of this kind of the product with the diabetes patients. So, and about the infrastructure, just so you know, we have 10 laboratory. This is a laboratory about hospital management system. So as I said, we develop all the system in our state. This is my laboratory, and we have another one space to store the device, but it's a medical computer laboratory. And this is the 3D technology laboratory. We have there are more than 10 different print machines using the different material to print the orthoses and prostheses there. And we also have an industrial CT scanner. For us, it's very important. It's like the same scanner for the body, but we use this for scanning the machine, scanning our product. Sometimes broken, we don't know what happened inside of the machine. So we have this scanner, industrial CT scanner to help us. This is a biomedical instrumentation and test laboratory. This is a intelligent system laboratory. They are using a lot of artificial intelligence. Usability and human factory laboratory. For us, it's very important to understand how is the experience between the machine and the human. So we have a laboratory just to work with that. Sometimes we produce the product or the system, and this laboratory make all the evaluation about usability. Is the medical device manufacturer unit, so the multi-parametric monitor, the cardio vessel we produce inside of this laboratory. So we are very happy because the next year we are moving for another building because we have a small place for us at the moment. The Minister of Health in the last year sent for us a lot of projects, and now we need to have more space. And I hope that next year we are moving for the new place to work better. So we have some social media. If you wanted to do something more, you can connect with us in this social media. But let me back to the main topic of this conversation. So, and I would like to give more detail about this project. I call this project Senior Saúde Móvel, or Senior Mobile Health. In this project, we decided to create a remote monitoring system for elderly people using the all concepts about the Internet of Things, wearable device, apps, dashboard, and how can you use the technology to monitor remotely the elderly people. And you have some motivations, of course. The population aging has become the major challenge entirely of the world. So I think you have this problem here in Canada. We have the same problem here in Brazil. And we need to think about how can we use the technology to monitor, to prevent, to detect early some risk for this part of the population, right? And the last year, the Brazilian government has funded several projects to think about, an institution that research to think about how can we create a new technology, how can we create a new solution to help to monitoring the elderly people, or to change this behavior or something like that. So, and the other point that motivated us to do something like that was a challenge among the full assessment for the elderly people. For example, if you wanted to know more about quality of sleep, we have two options. The first one is the gold standard exam is polysomnography, yeah? And the other hand, we have the questionnaires, recall questionnaires. And the both situations have some problem. So the first one, when we think about the example sonography, for us in Brazil, sometimes it's very expensive to do something like that. It's invasive because the person needs to sleep where a lot of wires in head, in their chest, in the hand. And sometimes it's not comfortable go out at home and sleep in another place. So I think it's not comfortable for them. And all these situations, sometimes it does not correspond to the partial real conditions. So in the finish of the exam, you have a result, but sometimes it don't correspond with the patient real conditions. Or the point is you have only a single measure. You have the person go there and make the exam, and you have the single mention, and then maybe in all life only that single measure. In other hand, we have the questionnaires. It's cheaper, it's very easy to apply, but we have also some problem, especially if you are working with an elderly people population. If you are working if a sample with the cognitive dysfunction, you have a big problem in the results, because sometimes they don't understand what are you asking in the questionnaires. If you are working, we have this problem in Brazil, because sometimes we are working with a sample with a very low education level, and sometimes it's very difficult because they can't understand what we are asking for them. And they make a lot of time the misinterpretation, the wrong interpretation, and they give it for you. The self-port sometimes is wrong. All right. And of course, we are working with the elderly people, and sometimes they don't remember what happened with them in the last few weeks. So I think we have a big problem when we decided to apply the recall questionnaire with the elderly people. And the last point, and the important point also, sometimes they want to provide you a social desirable responses, because they want to be accepted, you know? So sometimes I ask for them, your partners make some noise during the night, and the person say, no, not make noise, you know? So it's very difficult sometimes when we decided to apply a questionnaire. So we try to make the system to be between the both situation, the both conditions. We tried, and of course, and we try to get closer than gold standard exam using the artificial intelligence, machine learning, neural networks, and we try to train our algorithms to be more closer than the gold standard exam, because we have some problem when we talk about the recall questionnaire, right? So how it's work? For example, this woman, she's participating in a project since in 2020. She wears this wearable device, and she loves this wearable device. We have a big problem. Something happened in her device, because she wanted to wear always this wearable. And we have a kind of the partnership with a Fitbit company. The Fitbit, with this partnership, we can be able to collect the data from the sensors, and then we can develop our algorithms, you know? So all the data go to the platform, but the data that we can see on the dashboard, that is in behind our algorithms to analyze, to process the data for the healthcare professionals, see on the dashboard all the information. So this is the main screen of the platform. So we develop algorithms to understand the heart rate variability. As I said for you, it's very important, because some cardiovascular disease, we can see this number very low, low. And when we identify this, we can have some information about some cardiovascular disease. We also developed the algorithm to gauge speed. The Fitbit device don't give for us this specific information about the gait speed, but we know it's very important to monitor this indicator, because the gait speed has a very relationship with the falls and cognitive function and something like that. We also develop an algorithm to know how many times a person get out the bed during the night to go to the bathroom. And we know that the scientific community in the previous studies say to us that it's go to the bed more than 3 times during the night. It's clinical important. So we need to think about this. You need to investigate what happened with this person. We also developed the algorithm to understand more about the physical activity. I know that the Fitbit device gives for us this information, but here we decided to make something more with more details, because here we can know that the person will spend, for example, 10 minutes in a light activity, physical activity, moderate physical activity, or intensive physical activity. Because sometimes I want to say I want to prescribe for my patients, you need to do something, you need to change your behavior, you need to do some exercise, but not an easy exercise, not a moderate exercise, an intensive exercise. You can do something like that. So I can try to motivate them to change their behavior, you know? We also, can I use this? I think yes. Mm-hmm. And we also ask for them about it. We ask for them 2 questions about the fatigue targets, because then we can use this information with the other information to have the information about the frail syndrome. You know, frailty. Yeah. So we are studying this. So this is the data is collected day by day, and we can see here the day by day. So we can store this data, and we also can to set up goals for them. So I can insert some information, for example, the age, the gait speed, and the functional capacity, and then the platform say for me this person, this profile as possible to give 10,000 steps a day. And I can see, and I can say to my patients, you can be able to do 10,000 steps a day. And we try to motivate them to change their behavior. And we also can see the data by graph. As we can see here, this is information about every year. So the last February, the last March, the last April, May, and I can see here that in this case it's about the physical activity. And I can see here in May, this person is not so good, not very well, and I can see the data and I can see the performance of this person during the whole year, you know. And also we can, here is another example about the sleep stage. So we can see here the stage awake, the light sleep, the REM, and the deep sleep. Of course, some data is very important, but sometimes we don't have connective with everything. So we can collect the data from the wearable device, but we also collect the data in the other measures, and we can insert manually in the platform. For example, we are working with the elderly people, and it's very important to understand, it's very important to collect the data about calf circumference, you know, because this is given for us the information about the muscles, muscle loss. This is given for me information about sarcopenia. Sarcopenia? Yes. So we insert the information here, and then this information is integrated with the information, the data is coming from the wearable device, and then we can have the outcomes, right? And we can have the reports. So we always give the reports for the elderly people. I always say for my students that the data is there, the elderly people, the theirs. So the elderly people is not only our database. So we try to give back the data for them. We try to give back the information for them. In the beginning of this project, I teach them how can use the app and see the data in the app. But I realized that they didn't like to see the data here. And I thought maybe it's better if I do something, if I write something in the paper. So I started and I began to write the report, the information in the paper and print and give it for them. And they say, oh, it's very nice. I like it to have my information in my hands, not by the cell phone. I spent a lot of time to project the app. But in the end, they want to have their information in paper, and it's okay for them. It's okay. So now we decided to develop an automatic report, so I can just I show you the software run, the software work. I just needed to put some information, and the platform give it for me all the data with a recommendation, with a commentary, and then I can make a download, print, and give it for them. And they love it to have their information. And I always say to my students, we need to give back the information for them, because they not only a database, they are a person and they need to have the information. And we are also working now. If you ask it to me, Eujessika, what you are in working now to make better in your system, in the platform, it's this thing now. We are trying to training artificial intelligence that we call senior GPT. And it's very difficult because the platform get the information from sometimes the questionnaire, sometimes we insert some information, the data is coming from the wearable device, we have time series, so it's a lot of information for the artificial intelligence. But we are training this artificial intelligence to help the healthcare professional, and now we can write and have a conversation with this artificial intelligence. And sometimes I say to me, all my patients that not have a good sleep in the last week, for example. And artificial intelligence give it to me all the names with the address, with the number, with everything. So we are try to training these artificial intelligence to help the healthcare professional to analyze the data, and not just to see the data, but also to analyze the data, make some correlation between the heart rate variability and deep sleep and the stage deep sleep, and now they give it for me this information. So we are trying to training this, but it's very difficult. Sometimes because it's a huge data and different data, and sometimes the artificial intelligence hallucinates. Yes. But it's okay, no problem. I say, okay, take a time, and then I have to put you again and go there. And we recruit the people from the 3 different locations in Brazil. When I decided to work with this project, I tried to identify in my city what place work with the elderly people, and now we work with the 3 locations. The senior center, the people go there, the elderly people go there to make some social and cultural activities, sometimes just to talk, to have a conversation with each other. And there are about 300 people living there. So we collect the data from them. And we also have a great program in Brazil, in Paraíba especially. It's like the Paraíba government built the neighborhood only for elderly people, only for poor elderly people, pessoas pobres, elderly people, and they give it for them the house. So they don't need to pay nothing. And they live it together. And inside of this neighborhood, there are also a health care professional team. And we have a link with them, and we always give the information from the data for them, and with the data, with the information, the healthcare professional make some intervention, make some decisions to interventions with the elderly people. And the 3rd place is a university for senior. I don't know if they come here. But in Brazil, sometimes the elderly people didn't have the opportunity to go to the school when they were younger. And then the university now opens some classroom for the elderly people. It's very interesting. So they go there, and they go there to have a class. And we also go there to collect the data. They never to come us. We are always to go them. No? And this is the flow, the data collector flow. We divide the data collecting in 4 stages. The first moment is the first stage of evaluation, and I give more detail about everything. And the project of the colleague there are elderly people use the wearable device only for 7 days. 15 days, the hair project. But they use it for 7 days, and then they back to make the second evaluation. And in the end, we call the D-Day because it's the delivery reports. My student write the thesis, my study write the articles with the data, right? Give more details about the first moment. So in the first moment, we apply a general data questionnaire. So I ask you about the age, education level, civil status, medications, disease, incomes, and a lot of information to do the profile, yeah? And then we apply also the questionnaire about frailty phenottype by Lida Frida, because we are studying about the frailty syndrome. We also apply the Leganese cognitive test. It's the same like the mini-mental, mini-mental, but we don't use the mini-mental because we are working with a very low, with a people who has a very low education levels. And if you apply mini-mental, we have some problem because we have some bills, and we don't have this kind of the problem. We use the Leganese cognitive test. And we also apply the SARC-F screening, the SPPB short physical performance battery, and we are also to study about geriatric depression in this sample. So we apply this scale. And in the second month, so the elderly people go to home wearing the wearable device for 7 days, and then they back. And we apply the other battery of the questionnaires. So we apply the polar sensors, as I said for you, because we want to train in the wearable device. So they use in the same moment the sensor, the polar sensor, and the wearable device, and we collect the data from both devices, and then we can train the Fitbit device with the polar. We also apply the usability questionnaire because we would like to know how was the experience in the last week wearing this wearable device. And we also apply a questionnaire about adipose sleepiness scales to understand about the SNAP day. And in the end, we apply the Pittsburgh, the International Physical Activity Questionnaire, and self-report of nocturia. And we apply these 3 questionnaires only in this moment because we wanted to compare the data coming the self-report by the questionnaire and the data coming to the wearable device. So we have some papers describe what we find in these results. So we have some articles. We published some articles about this research. It was the first one. In this paper article, we describe how can we did the algorithm to detect the heart rate variability. And then we wrote a new article to describe the reference values for heart rate variability in a healthy elderly people using the wearable device. We have the reference values for heart rate variability using the electrocardiogram, but I wanted to give the information about the heart rate variability in a healthy elderly people, but using the wearable device. And here we can show these values. We also write a paper about monitoring sarcopenia with the wearable device. It was a systematic review, but then we wrote a paper, make some cut of points to describe the sarcopenia using the wearable device. So we have the cut off points to number of steps, calories, distance, and physical activity for elderly people that have sarcopenia, right? So in this paper, we describe the difference between, we compare the data come from the algorithms and the data come from the self-reports. In the end of this paper, we can find that we are able to observe that we have a correlation between the algorithms and step to identify to classify the physical activity, but the EPAC, this questionnaire, is not able to have any correlation with the algorithm. Maybe it's because when we are using a recall questionnaire in the elderly people, sometimes we have wrong results. Yeah, so we have the same results in this article. In the end of this article, we also can observe that the self-perception of sleep doesn't correspond with the objective measure from the device. And here we describe also some correlations. For example, the total sleep time, there is a correlation with race. The people who identify as Black had a less sleep time than the older race, and we have some correlation. We describe here. We try to make a monitoring for elderly people to develop a solution for healthcare professional. But in the other hand, we try also to write some papers to the scientific community, right? So this is just our example of the database. We have more than 600 people that we monitor now. We collect the data, all right? And I would like to show you the platform in the internet, I think. Mm-hmm. So, can you help me?
Okay. Because it's okay. At the far right.
Yeah. Okay. Yeah. And the second. Yes. So this is the platform working now for you. Yeah. So you have the patients here. So we can see for example, let me see. We can monitor them. So here we can have the information about only one patient. So information about heart variability, gait speed, and the information about heart rate also. As I said for you, if I click in the card, we can have more details about the information. For example, the step a day, we can have more detail. We can see also the data stores day by day, as I said to you. And here, as I said to you, we have the artificial intelligence. We can ask something for the artificial intelligence and have a conversation with the artificial intelligence. We also make some reports, as I said to you. So I can make some reports, for example, a new report here, and I can insert some information if you want. You can insert some information about SACF or something like that. And I can ask for the platform to get the information about the last 2 weeks, 1 week or 3 weeks, for example, like here, the two weeks, and we can make the report.
Stop sharing, so we have to stop and
Yes, I think it's because you share just only with one screen. Stop the share and then share again.
have a question.
Question while we're facing this. You said that you're monitoring actually 60 to 100 people or 600 people.
600 people.
600 people. And each one of them
500,
has,
né? 500, Matheus.
each one of them has access to their own portal, so they are able to follow their own information. But as you said, they prefer getting a report.
Yes, sometimes, yes, because we have a lot of healthcare professionals work with us. So sometimes I always say for the healthcare professionals, if possible, try to download the report and have a conversation with the elderly people to explain what we find in their report, you know?
And they're all using the same wearable device.
Yes.
Same type of wearable device.
Yes, the
Okay.
same. Yes, we have also we have a partnership with a clinical in the south of Brazil, and the people there, I think, have more conditions. Yeah, so there the people use the Apple Watch, and that is the same for Apple Watch.
Thank you.
And as I said to you, this is the report, so I can open here, for example, and and there is always a commentary and a recommendation about the data, but the last old word always so I can write something and I can remove everything. So the artificial intelligence here is not to replace the healthcare professional, but just to help. So I can change everything and I can make the download here. Sorry, it's in Portuguese, but we have this version, other version in English in the platform. So, and then I can make the download here, and I can print everything, and give you this information for the elderly people, because they have very interest to know about everything, you know. So it's a very good, very information. I think 60 page. Here about everything, then I can sit with them and explain with them about everything.
Sorry, there's another question. I noticed on the page that there is GPT, the AI you were describing to us. Is it currently available for all the clinicians to use?
Senior GPT.
No, not yet, because we are training but I think in the next year, this is available to use the platform. But I can have a conversation with them that we are not using for the reports, you know, at the moment. We have other artificial intelligence, but it's a simple artificial intelligence to make the commentary and the recommendation, because I just feed the artificial intelligence with the scores from the literatura científica.
Scientific literature, yeah. I speak Portuguese now.
I'm feel more comfortable now. And I think that's it. If you have any questions about this project or something like that, I'm available to discuss.
Mas não estava projetando, você pode tentar mostrar de novo.
A plataforma?
É.
There are questions in the chat, yeah.
No, because it's not sharing the screen with the.
They're asking to read, yeah, okay.
Okay, yeah, that's it.
Can you put the link to the site in the chat so people can just go there
Yeah.
from their own
Okay.
I think she's logged into the software, yeah.
Yeah. So here, for example, I can search some other measures for calf circumference, abdominal circumference, blood pressure, you know, I can measure with the other tools and put the data here to connect with the other things. I can use this platform to make some evaluation of my patient. For example, today, this patient, I did something like that. I prescribed some exercise, and I can write here, and I can have the stores like a electronic medical
Record.
Yes. Record.
Is this connected to the electronic medical record in Brazil and in your state?
No. We are trying to make something like that, because at the moment we know that we are the only research center to do something like that, like have the platform to connect the wearable device.
Yeah.
So we're trying to have some conversation to make some partnership with the.
To link it?
Yeah.
And how many clinicians are using it now?
We have more than I think because we deliver the solution for institutions. So at the moment we have I think more than 10 institutions using
okay.
this. For example, we have at the moment we are also monitor not just the elderly people but the workers. I told you the people who work with the
Truck drivers,
Yes.
yeah.
Because we started to develop everything for the elderly people, but then we started to participate some conference and something like that. And the most important institution for the workers, the truck workers, call for us, invite us to talk about the possibility to monitor the drive trucks, because they wanted to know more about the heart rate variability, quality of sleep, physical activity. So now we have this platform working in all our country, in all the Brazil, monitoring the drive.
Wow.
Yes, it's a very big project. It's a very challenge for us, but it was very good.
Very timely you mentioned that, because there was a terrible tragic accident on the south shore of Montreal last week. A 1 or 4-year-old son were killed by a driver who apparently had been driving 57 hours with only 2 hours sleep, and they're supposed to have
Yeah.
8 or something by law.
Yes. So that's the idea behind this project,
They're gonna do
because
a public inquiry.
yes, they want to monitor something like that.
Physicians.
Yeah.
Physicians in the emergency room.
Go ahead.
The wearable data is uploaded real time?
Yeah.
The system?
Yes.
Okay.
Yes. With the drive truck, they are using the wearable in the app in the same moment. So we have all this.
So there could be other
Yeah.
alerts.
Yes, sometimes we can something like that, give some alerts. And the most important idea behind this project is give this information for the management, the leaders to them, to say, hey, in the northern of Brazil, the south of Brazil, the people there are driving for many hours and don't do nothing about exercise or something like that.
And it's nice because it's a public institution, right?
Yeah. Yes. Yeah. Seste Senat, I think you know.
Yes.
But I wanted to ask you, because in Brazil we have the senior booklet, like we have for newborns booklet every time you go to the doctor, and there's the senior one, right? The Caderneta do Idoso.
Sim.
Is there any talk from the Ministry of Health to integrate the senior booklet with this kind of system?
Yes, I was talking about this with Professor Álvaro from Brazil. You know him. To do something like that, but we don't have some updates about this, But I know that this book, and I will try to develop this platform, this book. So if you see this platform with more details, you can see that we have something similar than
That overlaps.
So what does the senior booklet ask about? Is it the areas?
It's essentially like a
nutrition?
newborn book. Everything you bring it, everything you go to the doctor, and it has everything like cough circumference, like diet and sleep and questionnaires and all that. And you bring every time to the doctor and give control.
Yes. So when I decided to develop the system, I was looking for the book also, and I tried to make something that if you have an opportunity to put this software in our system, we are aware to do something like that.
Yeah, that would be good.
So Eujessika, great presentation. How do you control for breach in privacy, for example, because you're using AI now, and so how are we doing confidentiality?
The security part of it, the data and the security, the confidentiality.
All right. It's a very good question, because we did all the security data inspired in the security data from the Union Europe. It's very strong security. They have
The European one.
Yes.
Okay.
They have a hard and strong laws rules to, and we try to, in this platform, we made with older, because we had, before this platform, we had a project with the European Union. So we try to develop with all these rules from them, you know.
I'm wondering, for example, now you have like AI tools that are able to convert documents into, like, for example, podcast, audio messages. I wonder if you were able to use this report that you generated, and instead of giving it to them in a PDF format or like printed it out, what if you can convert it to a voice, like a dialogue, for example?
So instead of the printed paper,
Yeah.
take the content in the portal and make it into an interactive message to the person through their phone or
No,
video,
yeah,
or voice even.
No, sometimes we go there. We go there, for example, as I show you, that we work now in the 3 different places. And sometimes we print the report and we go there and go there, sit with them. And
There's a social aspect, I think, to the report.
Yeah. But I think it's not a problem if I'm
You can do it by voice
Yeah.
also, right?
Yeah.
Like through the phone, they can hear it instead of read it.
Yes,
Yeah.
but
Okay.
for us, for Brasilia elderly people, I think it's better if you go there to sit with them, explain everything.
Yeah.
When we decide to do something like that, we could to see that we increase the participate of them, you know.
The students would go, I guess.
Yeah, the
Okay.
students
Yeah,
go.
that's nice.
So it's just an idea, just to turn it off.
Yeah, from an efficiency.
Yes, it's
Yeah.
possible.
But in terms of the security, how does consent work? So a big part of us being able to use data for anything is the consent process. So do they consent to the institution to use the app, or do they consent to research, or both?
What?
Okay,
Yeah,
consent
help me.
and
Os participantes que vocês coletam dados, eles têm que fornecer algum tipo de consentimento para vocês.
ethics, yeah.
Yes, the same.
E o consentimento é a nível de pesquisa ou a nível de instituição?
Sometimes I need the institution, sometimes I need pesquisa mesmo.
So all these 1,600, you said, they all consented to the institution?
Yes.
And then you have separate research projects that these participants consented to the research project.
Because here we can't use the data in our healthcare institutions unless we get ethics and specific participant
No, but
consent.
we have a specific. Nós temos
Yeah.
termos de consentimento para todas as instituições e todos os
Like,
órgãos
for each
assinam.
institution.
Okay.
Dentro do tempo já está incluso lá o uso para pesquisa.
Sim, yes.
Okay, so
What?
yeah.
Once they provide consent for the institution, they also provide consent to research. To
Yes.
Automatically.
Yeah. In the
Gee,
same
that would be
process.
nice.
But they want to say, no, I don't want to participate, you know? They
In the
want
research.
Yes,
Yeah.
the people is able to say, no, I don't want to participate, but
Don't use my data, so they can consent to getting care in the institution and their data.
but we never have the problem like that. For example, yes, it's automatically. If the person wear the wearable, they don't need about what we are doing with my data. But of course, we have all the preocupação, all the concerns about the
Consent and
Yes,
data,
they-
yeah.
But
Because here, the person has to tick off, I consent to receiving care, I consent to my data being used for research.
okay,
Yeah.
yes. No, we
Yeah.
have
For the future, yeah.
Yes, when we invite them to participate the project, they sign the document, say, yes, I want to participate the
Research,
project.
okay,
And you can also use my data for research.
okay, so the acceptance rate is probably much higher
Yeah.
than maybe what we
Yeah.
have here,
Don't-
yeah. Well, I don't know if there are any questions in the audience or anyone's left to know, okay, go ahead, Claudia.
You mentioned that about 10 institutions are using the platform
Yeah.
right now. So what kind of institution, what is the profile for private, public?
Yeah.
And also who is buying the Fitbit? Who is it the institution or is it the research project or
Okay.
the parts?
Okay, we have universities using this because they want to research about the wearable device using different kind of population. For example, we have the the other university nearby my university use the wearable device, this project to monitor the
Pregnancy, yeah.
So we have the universities and some companies to workers to monitor their workers. And we just to deliver the platform, and the institution needed to buy the Fitbit, right? So the university buy the Fitbit, and we deliver the platform.
If a private clinic wants to use the platform, can they do it?
Yes. They just need to buy the Fitbit, and we make some partnership with them, you know? We sign some documents.
Of the research, you don't sell the use of the.
Yeah, so we don't sell the platform for some institutions, for example, university, because I wanted to get forced together to research about this, but the private companies, we sell the platform. Okay, for example, the workers, the truck driver, they make with us a great partnership, and they pay for everything.
And is there an API for the software where we can connect to our About Me or?
Yes.
Easily, yeah.
Yeah.
Okay.
Yes. I don't know because 2 years ago we implemented this platform in a long-term institution in Netherlands, and we needed to implement in their self, you know. I think I need to make the same here with you, for example. And I don't know if you have some what's the rules for you.
Yeah, we can figure that out.
Yeah,
It's pretty straightforward.
Yeah,
We
so-
have the data where we could store
Yes.
the data. Yeah.
Yes.
Similar to what's in Europe, we have a Canadian version. It's not as advanced as the European, but it's secure.
Yeah.
And they're trying to expand it so that it could, especially for the computing power, if their algorithms
Exactly.
running,
Exactly.
yeah.
Exactly.
So we have that. Yeah.
There's still time just for a quick question. I wanted to ask, so in the platform, I see that you have a view here. What type of clinicians are using the platform, and do you have different portals depending on the clinician, if it's a physiotherapist or occupational therapist?
All right. No, it's the same platform for physical therapy, doctors, nurses, is the same platform. But I can make the permission. For example, if you and Fernanda works in the same patients, I can give for you the permission to see only these patients, you know? So we can make these permissions in the platform. So Mateus also work in the platform, but he can't see your patients, your data patients. We have this.
I also saw that in the dashboard, you can select what you want to see for your kind of data. So let's say you're a doctor, you're going to be interested in this type of information. If you're a physio, you might play with the dashboard. Yeah, exactly.
Yeah.
So sorry, I just realized we hit 1 o'clock. We'll continue the discussion here, but I know everybody else. So I just wanted to thank you, Dr. Rodrigues. So that way we can close. Thanks for everybody who joined, and we'll continue the conversation.
Yeah.
So, sorry, go ahead, Sana.
No, I was telling one, it's the same as the business platform.
Yeah.
So sometimes a university wanted to start a pilot, and I can make a pilot only for you, you know, so I can make the different participating in the platform. So we have a lot of
Good.
participating.